So good morning or good evening or good afternoon to everyone. I'm Alfio Albasini from Switzerland. In my clinic here in Switzerland, my clinic is here since 25 years. We are dealing with different musculoskeletal components.
Yeah, I have spoken to physiotherapists that have been using EMG, and they have told me that they have met patients that have been having problems for a long time, and then just by seeing the right exercise or seeing how to get out of maybe a condition, they get good in just a short time.
Yes.
Is that your experience?
Yes, too. I would say for me, I think we know this from the research, or basically when we started to do manual therapy, we needed to prove what is actually manual therapy doing. So we could show how the patient could improve. But then we had the impression if you do a manual therapy technique, in order to keep the improvement, you need to put a piece of tape. And then added these two things, we got a good result. And then came the third thing. We realized that if you do an exercise after a manual therapy technique, the exercise which activate the muscle can stabilize, say, better the joint, for example, or can keep and maintain what you just did manually. So then the third study was to combine manual therapy technique, the tape, and the exercise, and that was the best result. And we know from the research, if you combine these three things together, you have the best result. The problem is only now to know which is the best exercise to maintain what you just did with the manual therapy technique or with the tape. And obviously with EMG, we can, we can really be specific to monitor which is the best exercise which will maintain the treatment you did, the manual therapy technique you did. And that's the best result, the best combination.
Yeah, and of course you talk about the best exercise. My feeling is that a best exercise for person A with a specific problem might not be the best exercise for person B with the same problem. Is that correct?
Absolutely, absolutely. And this is why I try always when I teach my courses to give this idea to the people. We do not have one recipe for one pathology, one problem, because the same problem in 10 different patients could be 10 different type of treatment, which would be 10 different type of exercise. So what I try to explain them is always assess, let them do a movement which produce the pain. Let's give them a movement change, an exercise, see whether they improve. If they improve, maybe this is going to work, but this could be different from one patient to the other. So there is not only one exercise, but different for different people.